There's a lawsuit right now involving a whole body MRI company, and it actually highlights why these pan body scans are useless. A patient got a whole body MRI, and allegedly narrowing in one of the arteries of the brain, the right middle cerebral artery, wasn't reported. Later, the patient ended up having an ischemic stroke in that same territory. And now, of course, it has turned into, if it had been reported properly, this could have been prevented. That's hindsight bias, because once you know the ending, everything before it looks obvious. But in real life, MCS stenosis isn't one automatic next step. It depends. First, was the scan even designed to evaluate blood vessels? Because if you truly suspect that, then we need a dedicated vascular imaging, like CTA or MRA of the head and neck. Second, symptoms matter. Was there a TIA like weakness, speech problems, things like that? Or was the person completely fine? And third, you still have to ask why it's narrowed. Plaque, inflammation, tear, or even artifact. Even if the narrowing is real, prevention is not guaranteed. You manage risk like blood pressure, cholesterol, diabetes, smoking, and sometimes medications like antiplatelets, depending on the full picture. But it's rarely as simple as see it and stop it. And this is the bigger issue with elective screening. There are no clear standards on what must be reported, what follow-up must be arranged, and where does the responsibility end. That's why we don't order pan-body MRIs as screening, because good medicine is targeted. Right test, right protocol, right question, and clear plan for what to do with the results. More scanning doesn't always mean more safety. Sometimes it just means more noise and bigger expectations than medicine can realistically promise.